Welcome to this quick guide to understanding health insurance. This video will help you understand health insurance, find out what your insurance covers, and what you can expect to pay for your treatment. If you have health insurance, this video is for you. If you do not have health insurance, please see our cost of care web pages at www.cancersupportcommunity.org/cost. The first chapter of our book, Frankly Speaking About Cancer, Coping with the Cost of Care, or call our helpline at 888-793-9355.
In this guide, we discuss the types of health insurance terms, practical questions to ask as you learn about insurance and medical bills, and information about resources for financial aid and advice.
Over the next few minutes, we'll tell you a bit about health insurance options, plans, and what key health insurance terms mean. There are two kinds of health insurance, private and public. Private health insurance refers to any health insurance that is not offered by a state or federal government. You may get private health insurance from your employer, through an online marketplace like healthcare.gov, or directly from an insurance broker. Public health insurance, any health insurance that is offered by a state or federal government. The main types of public health insurance are Medicare, a federal program for adults over the age of 65 and certain disabled individuals, Medicaid, a state-run public health insurance program for low-income individuals, and military benefits, a health insurance program for military members, their dependents, retirees, and some survivors and former spouses. Most health insurance, private and public, work with a network of providers.
In-network providers are the hospitals, doctors, and other healthcare providers that have a contract with your health insurance and will accept your health insurance's prices for treatment. Out-of-network providers or non-network providers are hospitals, doctors, and other healthcare providers who do not have a contract with your health insurance.
There are different types of private health insurance plans designed to meet different needs. Some plans restrict your provider choices or encourage you to get care from the plan's network of providers, hospitals, pharmacies, and other medical services. Others allow you to get care from providers outside the plan's network. The most common types of private health insurance plans are PPO, or Preferred Provider Organization, is a type of health insurance plan that contracts with healthcare providers, such as hospitals and doctors, to create a network of participating providers. This kind of plan lets you use out-of-network providers without a referral, but your out-of-pocket expenses are higher. PPOs tend to be higher monthly premiums in exchange for the flexibility to use providers both in and out of network without a referral. HMO, or Health Maintenance Organization, is a type of plan that limits coverage to in-network providers. It generally won't cover out-of-network care except in an emergency. You may also need to get a referral from your primary care doctor to see a specialist even if they are in-network. HMO plans typically have lower monthly premiums. You can also expect to pay less out of pocket. POS, or Point of Service Plan, is a mix between a PPO and an HMO, a type of plan where you pay less if you use doctors, hospitals, and other healthcare providers that belong to the plan's network. However, with a POS plan, you have the choice to use providers that are not in your health plan's network, but you will pay a higher fee for out-of-network providers. POS plans also require you to get a referral from your primary care doctor in order to see a specialist. HMOs don't cover out-of-network providers. PPOs and point-of-service plans do offer coverage for out-of-network providers, but your out-of-pocket costs are higher than if you saw an in-network provider. For this reason, to keep your healthcare costs low, it's important to know whether your providers are in-network or out-of-network.
To learn more about health insurance options, please see the second chapter of our book, Frankly Speaking About Cancer, Coping with the Costs of Care. To learn more about the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers, like health insurance, financial toxicity, disability insurance, employment, and more, visit Triage Cancer's website at www.triagecancer.org.
We'll dig deeper now and take a few minutes to explain what some of the most common insurance terms mean and how they work together.
The premium is a fee your health insurance company charges each month for your health insurance coverage. This fee is paid by you, your employer, or both you and your employer, whether you use medical services or not.
The deductible is the amount you must pay for care each year before your health insurance begins to pay for medical costs. For example, if your health insurance deductible is $4,000, that means that you have to pay up to $4,000 for a range of medical services before your insurance begins to pay. After you've paid the deductible, your health insurance will begin to cover health-related costs.
The copayment, or copay, is a set fee that you pay each time you receive specific healthcare services, such as a doctor visit or getting a prescription drug. Copay fees can vary for different services within the same plan. For example, your plan may require a $50 copay per visit to a specialist and a $10 copay for prescription drugs. You typically pay the copay at your appointment or when you pick up a prescription. Copays may apply before or after you meet your deductible. It depends on your plan.
Coinsurance is the percentage of costs you pay after you've met your deductible. The health insurance company pays a percent, and you pay the remaining percent. If your coinsurance is 20%, you would pay 20% of covered medical costs once you have met your deductible, and your health insurance would pay the remaining 80%.
Plan year is a 12-month period of coverage under a health insurance plan. A plan year may not be the same as the calendar year. To find out when your plan year begins, you can check your plan documents or ask your employer.
The out-of-pocket maximum is the most you'll have to pay for covered services in a plan year. After this, your health insurance will pay 100% of the covered costs. For example, if your out-of-pocket maximum is $5,000, then after you spend this amount on everything, your health insurance will pay for 100% of your bills for the rest of the year. Your out-of-pocket maximum may only apply to in-network costs. Your health insurance may not have an out-of-pocket maximum for out-of-network costs, or it may be higher than your in-network maximum.
Out-of-pocket costs refer to the total amount of money you pay directly. This includes deductibles, co-pays, and co-insurance, and costs for services not covered by your plan, but it doesn't include premiums. Remember that your out-of-pocket costs will be higher with an out-of-network provider.
To give you an example of how insurance benefits work, let's imagine that your health insurance plan has a deductible of $4,000, a specialist copay of $50, a co-insurance of 20%, and an out-of-pocket maximum of $5,000.
On January 1st, you go to your oncologist for a pre-surgery consultation. The amount billed is $250, but you only pay the $50 copay for a specialist according to your insurance plan.
On February 1st, you get your scheduled surgery and stay a week in the hospital. The hospital that is on your insurance network sends a $60,000 hospital bill. How much will you have to pay?
So, first, you will have to pay your $4,000 deductible, leaving a $56,000 balance. Since you have met your deductible, your co-insurance of 20% kicks in, meaning that your insurance company will pay 80% of the remaining balance, or 80% of $56,000, and you are responsible for 20%, or $11,200. You have paid to date $4,050 in out-of-pocket costs in copays and deductibles, but your plan has an out-of-pocket maximum of $5,000, which means that you only have to pay $950. That is $5,000 minus $4,050 for the remaining amount.
Keep in mind that premiums do not count towards your deductible or your out-of-pocket maximum. Usually, copays do not count towards your deductible, but they do count towards your out-of-pocket maximum. Services that are delivered by out-of-network providers or are not covered by your health insurance benefits do not count towards your deductible. They also do not count towards your in-network out-of-pocket maximum.
By law, health insurance companies must tell you what health care charges they paid and what they didn't. One way that they do this is through the explanation of benefits, or EOB, that you receive after a medical bill is paid. The explanation of benefits, EOB, lists health care charges and shows what has been paid by your health insurance and what has not. The EOB is not a bill, but it can be used to ask questions about bills and services that are not covered. You can also use this information to ask questions about your benefits.
Denied claims. Make sure you look at each explanation of benefits form you receive. There may be times when your health insurance denies paying for a medical cost. You'll know your claim was denied through this explanation of benefits form. If your health insurance denies a claim, you may be able to appeal or fight their decision not to pay for a medical service you've used. To make an appeal, first find out why the claim was denied. You can always ask an insurance care manager at the health insurance company. If you think you have a good reason to appeal, do it within the correct amount of time and with the right paperwork. Sometimes your doctor or employer can help you too. They may be able to talk with the health insurance for you. If they can, you may have a better chance at winning. It's a frustrating process, but sometimes the health insurance will pay after all.
Every year you have the chance to renew your health insurance or try something different. As you learn more about your needs, you will have a better sense if it is best to renew or try something different. Ideally, you can get a health insurance that will help you get the services you need at costs you can afford. Throughout the cancer experience, you can and should advocate for yourself. Take one step at a time and remember that you don't have to do this alone. There are resources that can help you choose a good health insurance, including the Cancer Insurance Checklist.
To learn more about managing the costs of cancer care, look at 10 Tips to Help You Lower the Costs of Cancer Care Quick Guide, Understanding the Costs of Care Quick Guide, Cancer Support Communities Helpline at 888-793-9355, where community navigators can help you with financial questions, emotional concerns, or finding resources. Also, there are several valuable resources listed in the Frankly Speaking About Cancer Costs of Care book or web pages at www.cancersupportcommunity.org/cost. To learn more about health insurance basics, watch Triage Cancer's video at www.triagecancer.org/video-health insurance basics.